Okay, so today let's talk about some urinary pathology. So let's first go over our list of things we really need to make sure we remember. So carcinoma of the bladder and carcinoma of the kidneys is going to just be basically cancer of the bladder and of the kidneys. Both of these are harder to penetrate, meaning that we need to go up on our technique to take an image of these. Cystitis here is just an inflammation of the urinary bladder. Glomerular nephritis is going to be an inflammation of the glomeruli, which is kind of a functional part of the kidney. Polycystic kidney disease, a little harder to penetrate, meaning it's additive, which is why we need to go up a little in technique. Pyelonephritis is a kind of inflammation with pus of the kidney and renal pelvis. Renal calculus or stone. If you ever see calculus or calculi, it's referring to a stone. And then we know renal, it means it's in the kidneys. Sometimes people may have stones in the ureter, sometimes stones in the gallbladder. So you might see calculus used in more than one instance, but renal always refers to the kidney. Overall, it's harder to penetrate because it is a little stone, but we don't change our technique overall because it's just such a small pathology typically. Renal cysts are a little harder to penetrate, and those occur in the kidney. And then Wilms tumor is mainly a pediatric condition, and it's a little harder to penetrate. So if you were going to go up on technique, that would only be from an already pediatric or lower technique. Let's go ahead and take a look at an x-ray of polycystic kidney disease. So we know from our medical terminology background that poly means many. So what we're looking at are many cysts within the kidney. So we see the kidney here, and then we see one cyst here, another here. We can see there are many cysts. And again, this is an additive disease, so we need to go up on technique. All right, so the next x-ray we're going to look at is pyelonephritis. Pyelonephritis is characterized by clubbing of the minor calluses, and then we go into the major calluses, and then eventually into the renal pelvis here. But this clubbing or kind of blunted ends of these minor calluses are very characteristic of pyelonephritis. Excuse me. This is an X-ray of a patient who's had contrast injected. That's what this bright part is. In general, even though this is kind of an additive disease a little bit, the very fact that we are using contrast to highlight this disease, we need to go up a little bit in KVP, just because that contrast is there in general. Okay, the next x-ray we're going to look at, well, the last x-ray and CT, which we can see here, is going to be of the renal calculi or stone. Now, typically when you are looking to see if there's a stone present within a patient's urinary system, you do not want to add contrast like they've done here. Luckily, they were able to kind of identify the stone here, even with contrast occurring in this looks like the ureter right now. So this would be a ureteral calculi. But anyway, you don't usually use contrast because it can tend to obscure the stone. So for example, here in the CT, an axial CT image, we can see that they did not use contrast. And what that has allowed is for the stone itself to kind of highlight, and then we can see it here within the kidney. And here it looks like it's more so in the ureter.